Spousal and partner abuse is a complex topic that demands our attention, and this episode serves as a companion to Therapy Training's Spousal Abuse Training course. We will navigate the historical and societal contexts of abuse and its effects on mental health outcomes. Expect to gain insights into recognizing signs of abuse, assessing safety needs, and applying therapeutic interventions to support those affected. First, let's take a moment to reflect on the historical and societal context of spousal abuse. It's crucial to understand that this issue is not new. It has roots that stretch back centuries, often embedded in cultural norms and societal structures. In many societies, power dynamics have historically placed men in positions of dominance, while women have been relegated to subordinate roles. This imbalance can create environments where abuse becomes normalized. Did you know that according to the World Health Organization, 1 in 3 women worldwide has experienced physical or sexual violence? This staggering statistic highlights not only the prevalence of spousal abuse, but also the urgent need for mental health professionals like you to be equipped with the knowledge and tools to address this issue effectively. Now let's transition into identifying the signs and symptoms of spousal or partner abuse. Recognizing these signs is a critical first step in helping those who are affected. While the behaviors of abusers can vary widely, there are common patterns that can indicate abusive dynamics. For instance, watch for signs of emotional manipulation, such as constant criticism or attempts to control a partner's actions or relationships. Physical signs may include unexplained injuries or frequent absences from work or social events. It's also worth noting that abuse doesn't always manifest in obvious ways. Emotional and psychological abuse can be just as damaging as physical violence, leading to significant mental health issues like anxiety, depression, and post-traumatic stress disorder. As mental health professionals, it's essential to be vigilant and aware of these indicators, especially in diverse populations where the signs may vary or be less visible. But how do we assess the immediate safety needs of individuals experiencing spousal abuse? This is where your training and skills come into play. When you're working with someone who may be in a dangerous situation, it's vital to create a safe space for them to share their experiences. This involves not only a compassionate listening approach, but also an assessment of their immediate safety. Ask open-ended questions that can help you gauge their situation. For example, you might say, "Can you tell me about your home environment?" Or, "What are some things that concern you about your relationship?" These questions can help the individual assess their safety without feeling pressured. Always keep in mind that the goal is to empower them to make their own choices while providing support and guidance. Now let's discuss some therapeutic interventions and best practices. One of the most effective approaches to supporting victims and survivors of spousal abuse is the trauma-informed care model. This model emphasizes understanding the impact of trauma on an individual's life, which is especially pertinent in cases of abuse. It's important to recognize that re-traumatization can occur during therapeutic interventions, so we need to be careful and intentional in our approach. Using a trauma-informed lens means acknowledging the person's past experiences and avoiding any actions or language that could trigger negative memories. For instance, when discussing the abuse, it's beneficial to allow the individual to share at their own pace. You might say, "I'm here for you when you feel ready to talk about your experiences." This can help create a safe environment conducive to healing. Additionally, it's essential to recognize the interconnectedness of spousal abuse with other forms of interpersonal violence. It's not uncommon for someone experiencing partner abuse to also have a history of childhood trauma or to be involved in other abusive relationships. As mental health professionals, we need to understand these connections to provide comprehensive care. Consider using holistic approaches that address not just the symptoms of abuse, but also the underlying issues that may contribute to the cycle of violence. Now, let's address some common misconceptions surrounding partner abuse. One prevalent myth is that abuse only occurs in certain demographics or socioeconomic classes. The truth is, spousal abuse can happen in any community, regardless of income, race, or education level. This myth can lead to a lack of awareness and understanding, making it all the more challenging for victims to seek help. Another misconception is that victims can simply leave their abusive partners if they wanted to. This oversimplification ignores the complex web of emotional, financial, and social factors that keep individuals in abusive relationships. Many victims may feel trapped due to financial dependency or fear of retaliation, making it vital for us as professionals to approach the subject with sensitivity and empathy. So, how can we address these misconceptions? First, we must educate ourselves and others about the realities of spousal abuse. This includes understanding the psychological manipulation often employed by abusers, which can create confusion and self-doubt in the victim. By promoting awareness and sharing accurate information, we can contribute to a more informed society that supports victims rather than blaming them. As we wrap up today's discussion, I want to leave you with some thought-provoking insights. Consider your own beliefs, biases, and attitudes related to spousal abuse. Reflect on how these perspectives may influence your approach to therapy. Cultivating a trauma-informed approach requires ongoing self-reflection and a willingness to learn about the complexities of abuse. If you're interested in furthering your understanding and skills in this area, I encourage you to explore the course offered by Therapy Trainings. The comprehensive curriculum will provide you with invaluable knowledge and tools to better support your clients. You can visit therapytrainings.com to learn more about this course and others they have available. Thank you for joining me today as we explored the critical topic of spousal abuse. Remember, as mental health professionals, we have the power to create change and support healing for those affected by this pervasive issue. Let's continue to educate ourselves, challenge misconceptions, and cultivate a trauma-informed approach in our practice. Until next time, take care of yourselves and your clients.